And now it is my pleasure to introduce today's moderator, Kelly Saldana. Kelly Saldana is the Director of the Office of Health Systems at USAID's Bureau for Global Health. She has more than 20 years' experience in public health administration and international development, having served in a variety of roles within USAID, including most recently as the Deputy Director for the Office of Infectious Disease. Kelly has led a wide array of health programs throughout her career, including USAID's Haiti earthquake response, and more recently, the agency's Zika response. We are delighted to have her here with us today. Kelly?
Thank you. Good morning, good afternoon, good evening, everyone. We're really pleased to see so many people joining us today for what we hope will be a very rich discussion. I want to briefly introduce our panelists, and then I will provide a couple of opening remarks before we move into presentation and discussion. But today's panelists represent some of the many actors across the private sector who contribute to a health system's resilience. First, we have James White, who's the clinical advisor for SHOPS Plus with ACT Associates. We have Ralph Ancri, the senior project manager for business development at Orange. Dr. Grant Aaron, the global health director of Massimo. And Philippe Moutwa, a global health security agenda advisor from USAID Senegal. So at USAID, we support approaches to health system strengthening that build the capacity of the public and private sectors so they're as prepared as possible to maintain routine health services and to respond to health emergencies like the one we're currently experiencing. We recognize that a health system cannot be resilient if it is not strong, but a strong health system is not necessarily resilient. And so what do we need to do to make health systems both strong and resilient? We feel we need to empower individuals, enable processes and practices, and establish rules and regulations that allow for adaptation and change. And in these ways, we can enable the health system to respond to changing conditions and to promote the emergence of resilience. We use system practice to do this, and we're shifting our focus from the inputs of the health system or the building blocks to the outcomes that we want to achieve, such as equity, quality, and resource optimization. We feel this enables us to talk about the interactions between demand and supply within a country health system and the pressures from a multitude of stakeholders that influence those different sides of the health system. We also think that furtherance to that, resilient health systems have strong and reliable links between all sectors. That includes the public sector and the private sector, and within the private sector, including civil society, community-based organizations, as well as the for-profit and not-for-profit private sectors. In particular, community-based organizations and community leaders, whether they work in the public or the private sector, are critical stakeholders for building health systems resilience because they are the voices for the communities and are viewed as trusted sources of information. They help raise awareness across the population and influence behaviors and cultural norms. For example, recently in Laos, we've worked with local institutions to expand and improve health services by training pharmacists in the private sector who are considered a trusted source of health information for many communities. USAID teamed with the government of Laos to train pharmacists to identify the warning signs of COVID-19 and provide appropriate counseling to their customers on hygiene, self-isolation, and home care, and to refer patients to testing if needed. The project also trained local civil society organizations to support infection prevention and control measures in communities, especially in rural areas where access to healthcare can be challenging. So that's just one example of a partnership across the public and private sector, which really helps to build health resilience. We recognize that there's other actions that do this as well. Earlier this year, USAID's HRH 2030 project launched a Health Workforce Resilience Prize competition to recognize private sector organizations who are coordinating with public sector institutions to strengthen the health workforce within their local systems. One of those winners is PNH Health from Brazil, which is a private technology organization that developed an app called ViTalk, which helps health workers manage anxiety, stress, burnout, and other emotions that can challenge their efficacy in their jobs and improve their overall resilience. The mental health app works on a mobile phone to deliver psychoeducation, mood monitoring, and other exercises in a conversational format. It uses validated outcome measures to identify mental health risks and signal where professional support might be needed. In parallel, the chatbot and AI platform can send text messages to help healthcare organizations engage and monitor populations on a large scale. So again, those are just a couple of examples within USAID of how we're trying to expand the notion of health system strengthening and health systems resilience to really include all of the actors within society. And so we're really excited to talk about this new work from SHOPS Plus, which really helps to articulate better the role that private sector engagement in particular has in creating this overall health systems resilience. So before we jump into our discussion, I'd like to ask James to give our audience an overview of the private sector engagement in health systems resilience strategic approach developed by SHOPS Plus, which is, as you know, USAID's flagship project in private sector health. We think his presentation will provide a framing for our discussion today.
Great, thank you so much, Kelly. Next slide, please. So I'm really pleased to be here with you all today, and thank you to everyone calling in from wherever you are in the world. Today I'm presenting some of the findings from engaging the private sector in health system resilience efforts, a strategic approach that we created with support from USAID. Next slide, please. So what we found in collating information and frameworks and guidelines from around the world is that indeed we live in a world of threats. Many of our global communities and health systems face threats from disease outbreaks and epidemics, natural disasters, human-caused accidents. We see the damage that economic crises or political unrest, war and conflict or bioterrorism can face, put threats on health systems. In reality, any diversion from the norm, both in terms of the everyday challenges that we face in health systems and also abrupt large events that we're all familiar with over the last years and decades. All of these can overwhelm health systems. And so when we think about the world of hazards we live in, we think about ways in which our health systems can, as Kelly alluded to, become more resilient. Next slide, please. So the real challenge is, how do we as global partners and communities and individuals better prepare ourselves? And all of the literature in one way or language says that it must be a whole community response. No single actor, no single agency, no single individual or community can address some of these complex challenges of preparedness alone. Other key questions: how do we balance those needs for preparedness and the financial and other challenges that come with that with so many other urgent challenges facing not just our health systems, but families, communities, and nations? How do we work together? Who's best placed to do what? We know that there's comparative advantage of certain partners doing certain things at certain times. How do we align all of that? And again, and most importantly, perhaps, how can we act more quickly and more decisively in all of these efforts together? Next slide, please. Some of the key concepts you'll hear today are private sector, health systems, shocks and stressors, and health system resilience. So very briefly, the paper that I alluded to and our discussion today takes some of these key concepts into consideration. The private sector really refers to all non-state entities in our definition and in USAID's definition, including commercial, nonprofit, faith-based actors working across the health system. Those include actors in the private sector that work within the health sector, but also those industries and corporations and commercial entities that support health system functions. When we talk about these threats to the health system or threats to resilience, we talk about everyday stressors. These are the things that we're familiar with in terms of the contextual dynamics of health service delivery, things like human resource shortages, supply chain interruptions, financing barriers. These are the stressors that many health systems face every day. And so USAID talks in many ways about everyday resilience as a building block. We then talk about bigger shocks, and these are the more time-bound, abrupt events like disaster, like pandemic, that require our surge capacities across the health system and, as Kelly mentioned, a coordinated and ever-increasingly coordinated response. So then a resilient health system really is one that's adequately prepared to maintain both those routine functions, but also escalate emergency operations among partners, among actors, when they are faced by a stressor or shock event. Next slide, please. So again, in collating many of these guidelines, frameworks, experiences from around the world, both in terms of older experiences, but some of the new innovations that Kelly's mentioned, we took all of that into consideration, and the paper really highlights that late action and poor coordination is one of, if not the key challenges in every real-world experience for resilience, as well as many tabletop exercises. Coordination of all these actors is key. Resilience and the concept of health system resilience is also very heavily tied to the global health security agenda, which came out of the Ebola epidemics of West Africa in 2014, and also the WHO's joint external evaluation process, which is really tangibly trying to measure and understand particular strengths and weaknesses of health systems. Overall, and even this past year with COVID, we've seen how emergency can maybe be used as an opportunity for broader health system strengthening, as Kelly mentioned. And we have some success stories in the literature to share. Certainly, Hong Kong's tourism industry had a lot of negative experiences with SARS in 2003, but increased private sector engagement led to a much better experience, a global leading experience with H1N1 in 2009. We saw how Liberian employers stepped in as providers of information in the Ebola crisis of 2014. We saw in Indonesia currently in Indonesia how the private sector has organized themselves to be a constant and reliable source of support for multiple natural disasters. And we've seen other examples of private sector engagement being successful during COVID-19. Next slide, please. So then when we look at building a strategic approach based on all of these lessons, something tangible that USAID missions or other partners can use to really start getting into the detail of how to solve these issues, how to mobilize multiple partners, we see that there are two really key moments. One, before an event occurs, and obviously second, when a major event occurs. So before an event occurs, we need to act early, and this has been said many, many times. We've seen that we're, as a global community, becoming better at coming together as public-private partners during emergencies, during shocks. But during that peacetime, during that calm before the storm, we're not acting early, and we're often late reacting. Excuse me. Second, we need to strengthen and prepare the health system, again, by addressing both stressors and shocks, both those everyday issues that weaken health systems, but also bigger planning and financial preparedness efforts. We need to invest in targeted risk assessments and private sector analyses to inform this planning. And again, this is a very strategic way of understanding which partners are available, what skills and resources they have to offer, and knowing which partners can be mobilized at various stages of a disaster or shock event. And we need to develop different types of partnerships more broadly to engage different types of partners earlier. And a lot of the literature has talked about different contracting mechanisms and other tangible ways this can be achieved. And we touch on those in the paper as well. Next slide, please. When an event occurs, and this is here a disaster life cycle that maybe we're more familiar with in terms of preventing and containing an event, detecting and surveilling it, responding to it, and eventually, ideally, recovering from it. If we're to achieve public-private health system resilience in a truly collaborative fashion, then we need to understand different partners' roles at different times in this cycle. And our paper goes into detail on how partners, through the analysis I mentioned, the partner mapping, partner assigning of roles to specific activities and specific needs during this life cycle, can tangibly and rapidly improve preparedness planning. Next slide, please. So we encourage you, that was just an overview to help frame the discussion. We encourage you to read the full report if you have time, and you can find it there at the Shops Plus Project website. Now, really pleased to start digging into some of these key issues, and I'll hand it over to Kelly to moderate our discussion. Thank you so much.
Thank you, James. That's a great overview. So again, that was James White, who's a clinical advisor on the Shops Plus project with Apt Associates. So I want to open the discussion to the others on the panel. Again, we have Ralph Ancre, Senior Project Management for Business Development at Orange, Dr. Grant Aaron, the Global Health Director of Massimo, and Philippe Moutwa, Global Health Security Agenda Advisor at USAID Senegal. Thank you all for joining us today. First, I'd like to start with the principle of acting early to develop preparedness, as it is one of the most important pillars to achieving health systems resilience. Over recent years, there are a growing number of success stories demonstrating that the public and private sector can work together during emergency responses. However, there's maybe not as much evidence that private sector engagement during times of calm or normal is occurring. And I think this is really needed to achieve the overall resilience. So why do you think that it's not occurring as much during sort of the normal calm period? Maybe we'll start with Philippe.
Okay, thank you very much. And also thank you very much for Shops Plus that invite us to attend this event to discuss the private sector engagement in public health during emergency response. So, first of all, just why it did take time just for private sector just to be part, or just in any case when we have outbreaks. That's why it may take time just to involve the private sector. I don't know if this was the question. I was just trying to fix my technology issues here. If you can just repeat so that we can go from there.
Sure. We were just asking, why do you think that there's not as many examples of private sector engagement with the public sector to build health systems resilience before emergencies happen?
Yeah, thank you very much. Yeah, now it's much clearer. So I just first of all have to apologize. I'm not really a private sector expert in the field. So my experience just working with the private sector just started the area with this COVID response, but just with the GHSA work we have been trying just to drag in the private sector just to invest more in emerging disease threats, just response and prevention. So why? Just there we can just look broadly about just the awareness of both on private sector. I think on my side, I think that the public sector doesn't really understand or have a global picture of the potentiality within the private sector that we can invest in health system. That's one. So the second is so when we look on the other side, just building on my experience with the global health security agenda. So one day, just I was having a meeting with one of the telephone operator here in Senegal, just to see how can we leverage the technology just to invest in disease surveillance. So I came to understand that the private sector don't really understand the health system needs. So there is a lack of knowledge or lack of awareness on both sides. So that one thing. So the other thing maybe I may say just lastly is it doesn't really look like the private sector understands, for instance, if an outbreak or if emerging disease just occurs, it will affect the sector. So I think that we need, just to have a clear, plan that will be communicating, even just if we have an outbreak or emergency disease that will impact the private sector. I think that the lack of this awareness or understanding of any disease on the impact of the productivity, and that also is something that I think I might say just can delay or just can prevent the private sector investing in the health system. Over.
Thank you. Grant, maybe I will throw the same question to you and you can react to Philippe's thoughts and provide some of your own from the more private sector perspective.
Great, thank you, Kelly. So just to start out, I represent industry. Massimo is a global medical technology company. The private sector is very broad and encompassing, and I'm sure different organizations would have different perspectives. I'm actually very pleased to sort of challenge that paradigm, actually. There have been some incredible initiatives that are taking place or have taken place during, quote, calm periods. You know, the USAID shops is obviously one, which we're talking about today. Another very important organization is the Private Sector Roundtable, Psrt, which I'll put in the chat box shortly. The Psrt was formed at the 68th Global Health Assembly. It's a steering member of the Global Health Security Agenda, which comprises of 69 countries, and there's been a lot of activities prior to COVID. And I think one of the big lessons learned that we've seen during, the pandemic response is the importance of this. So I certainly hope that when things eventually do go back to a, quote, calmer state, there's a lot more focus and attention into this. The other, big point to highlight, I think, is just having that inclusivity and voice at the table. And it's entities such as the Psrt that provide a number of different stakeholders with a voice and a platform to be able to share and network and communicate with other organizations. I'll stop there. Over.
Thank you. So I want to bring in Ralph into the conversation and maybe bring it out a little bit more to the successes that we have seen in health systems resilience in the context of shocks and emergencies, and recognizing that a lot of those are within the realm of technology and technology partners. And so in addition to sharing information, how do you see technology partners as being able to contribute to or strengthen health systems resilience? In particular, building on the previous conversation, how can technologies help us better at the planning and preparation stage?
Thanks for the question, Kelly. Side of Orange, before, I will say to promote, to propose, or contribute to technology, we try first to understand the problematics, and we co-design and co-construct with the Ministry of Health and the funding provider the tools. So the technology is very large. The technology, in case of emergency, we all know that during the Ebola or the crisis, the technology is very strong and it is very important. As beside the hotline, I'm not going to list you all the technology, but we have today the digital tools, the hotline, the IVR. We can use, mobile phone to have a chatbot. Many technology. So yes, today I will say the importance of digital tools and the technology is very relevant on the health emergency. So beside this, we have several projects already, in collaboration with the several partners, and we contribute as a win-win, I will say, program. Because it's public-private partnership, and we try to understand problematics, and we answer in different ways. For example, a project with Gavi for vaccination to strengthen the immunization. We're going to tailor-made application and develop application to remind mother to vaccine the child, for example. So, and Besides this, we can imagine a lot of other technology using, for reach the unreached people. Mean that, sometimes we don't have a real coverage network, so we use different technology to allow people or rural patients to access through basic technology like USAID or SMS. So the technology has to be answer the problematics, and that's we try to do in different projects. So yeah, we have like I say, different way to do it, and follow, like I said, the problematic of the Ministry of Health.
Thank you. James, maybe I will bring you into the conversation. I'm hearing that there is a lot to be offered on from both the public sector and the private sector, but perhaps sometimes there's a disconnect in really forging those partnerships and bringing those additional voices together throughout sort of all stages of the disaster cycle. So I wonder if your work has shed light on how to forge these, forge better trust between both public and private sector sides, and if you have any examples to share.
Sure. Yeah, thanks so much for the question. I think the points raised do show that there's a lot going on. It's sometimes coordinated. I think when we did the sort of discussions with key informants on both sides of this discussion, the three key things come to mind. One, the language is very different. And so when private sector is talking about resilience and their sort of activities toward that may not be in the same verbiage that Ministry of Health uses. So there's that language issue. There's obviously the trust issue that you've mentioned. And so particularly, when you bring in new partners, when you're doing this sort of partner matching that I've described, there's a lot of complications around trust and trust building there. And then I think the third is, I know as an implementing partner having these discussions over the last little while, it's a bit like selling insurance, right? You're trying to get ministries of health, ministers of finance, partners to invest in this coordination before something happens that may or may not happen. And they have many competing priorities today. So I think whether it's language, trust, or just the competing priorities, these are all why things are not maybe clicking the way we'd hope.
Great, thanks. And I'll remind everyone, the audience, please, if you have questions of your own, put them into the chat box and we'll try and get to them. In the meantime, I think maybe we'll shift gears a little bit and talk about the value that the private sector can bring in expanding the resource pool towards the efforts that we're trying to work on. The private sector can be a critical source of financing in a corporate social responsibility context, but really I think within USAID and the purpose of this discussion is to identify a strategic approach where we can identify ways in which private sector stakeholders can be engaged with the public sector for sort of mutual benefit. So beyond financing, what do you think are the top 1 to 2 skills that the private sector has to contribute that the public sector should be paying attention to? Grant, why don't you kick us off with that question?
Great, sure. Thank you, Kelly. So the most important point that I would like to highlight is innovation. We've seen during the pandemic response the incredible amount of innovation that's happened, which is imperative to helping moving logistics to developing vaccines. An example from our side, prior to the pandemic, in the field of pneumonia, which is the #1 killer of kids under 5, we were approached in 2015, 2016 by the Bill and Melinda Gates Foundation to develop a tool for helping to monitor and evaluate or screen children at risk of pneumonia. And so, that is a contribution, at least from the industry side. That's a tool that's developed, which helps the public sector tremendously, particularly at lower resource facilities and settings to be able to implement programs. And I think, part of the success of these types of innovations really depends on the inclusivity that I mentioned before, and the ability for, at least in the perspective of industry players, to be able to learn and understand exactly what has to be solved. The second thing which I want to mention is regarding sustainability. And, you'd highlighted corporate social responsibility. A big part of that responsibility relating to the financing is to make sure that everything that's done is sustainable. And at least in how we're approaching this, is to develop sustainable business models that are high value and high public health impact. Over.
Great. And Philippe, to maybe bring it back to the public sector perspective, or from a USAID perspective, have you seen examples of where private sector innovations and these other skills that Grant mentions have really made a difference in Senegal?
Thank you. Thank you, Kelly. Yeah, for sure. There are so many examples that we have seen where technology has brought so many impacts on the health system. So first of all, just in Senegal, I may say that the private sector in the health system is at every level of health pyramid. For instance, currently we have 40% of the health facilities are in private sector. And during this COVID response, 75% of the patients were really managed in private care services. So just to let you know how the private sector is big in the country. So some of the examples that I can share, I think one of my and this we worked a lot with mobile telephone operators just to try to track and identify contacts. So they have developed some really new technology which supported a lot in the COVID response that we use. So there are so many, so many instances that we can share where we have seen in Senegal that the impact of the private sector in health system. So one of the big program, which is the supply chain management system. So I think that we are trying now to think how we can leverage what is in the private sector just to try to bring, the medical commodities at the last mile, just using what exists. I think that we have a lot of discussion going on. How can we use that technology just to, for instance, just to see, to track the stock at every single level of the health system, and also just using the private sector, channel that to distribute the medicine. So for the USAID perspective, I can say, I think that's seeing the private sector as the enabler. That has a lot of expertise and then competencies, skill set that we can really use. So one of the 5 or the 4 pillars just for the resilience of the system, just we have. USAID is considering just the engaging private sector as the big opportunity just to put in health system in place, which will be more sustainable over years. So I think we have a clear eye and we know exactly what the private sector has, and we can move from what we really have in the country from the experience we have seen. Over.
Thank thank you. I see in the chat that there's a question about activities in Indonesia, and I will just note one of the things that we at USAID have been very excited about is one of USAID's programs in Indonesia won a Digital Development Award for the efforts to strengthen human resources for health information system, which provides, real-time data for strategic use, and that we noted really enabled the Indonesian Ministry of Health to develop and deploy data dashboards on the health workforce for decision-making in response to COVID, and really recognizing that a lot of the resilience capabilities that a system requires is this ability to flexibly adapt and deploy resources where they're needed most. So maybe I will start with Ralph and just wonder, I don't know if you know anything specific about Indonesia, but just building on that idea, how can technology and other private sector innovations enable sort of this quick and flexible adaptation that really is a hallmark of health systems resilience?
Yeah, thanks. So yeah, exactly. I forgot to mention also collecting data in real time and to analyze the data and to propose the dashboard, overview dashboard to decision making. So that kind of tools that today Orange with this partner develop and propose, and is very important today. And I guess more and more the data analyst and the data scientist is very relevant to understand the problematics in emergency resilience. Like today, COVID, you can, from the CDR collect anonymized, but we can follow the movement of the population, and we can follow, the risk of the epidemiology in the different area. So that kind of technology we propose today, and we integrate on the different projects. And that's, also the thing is very important. Like I said before, we need to understand, and that's why it's very important to co-design and to co-construct with the ministry to make the private sector understand the problematics and to respond to the needs. So, the real-time data is very, I will say, relevant and very important today. And we have more and more requests on data analytics today. Beside this, we also collect information for example, the diagnostic tools information to collect, all the information on that. And so we collect as much we can the data to have and to bring to the Ministry of Health this overview of the situation.
Great, thank you. James, maybe you can bring some of this together and talk about any lessons you have about sort of the ability to capitalize on public and private sector engagement, but to do so quickly and flexibly so that it is there and adaptable as needs arise.
Sure, yeah, and when folks have time, I do encourage them to read the full paper, as there's sections that really dive into some of the details on accomplishing many of these tasks. I think for preparedness planning for resilience, a big lesson was having agreements in place, pre-prepared contracts in place, having the paperwork, the business, the red tape taken care of before an event occurs as much as possible, so that response partners can be mobilized quickly. But then more importantly, to what Mr. Ankri and Dr. Aaron and others have been talking about, ensuring that all partners are at the table early enough so that preparedness discussions are not occurring while events are being responded to. We're typically, and although today our panelists have presented some positive challenges to this, but we're typically reacting. We're not preparing. And so I think bringing this all together, the more that we can have, these key questions of who should be mobilized where, when, for how much money, for how long, these can be answered in advance so that they aren't questions we're answering in an emergency scenario. Over.
Thank you. Okay, I see a question for Grant in the chat. It's great to see, It's great to see private sector and industry organized together through platforms that you mentioned, such as the Psrt. Do the country governments participate in this platform? And if not, how does the Psrt or even companies like Massimo connect within the health system and the government?
Yeah, thank you. That's a great question. So, as I said, the Psrt is a steering member of the GSHA, which is comprised of 69 member countries. So it has a major consolidated voice, with a number of different countries. There are other mechanisms as well that are extremely important. I think that's, representing Massimo during the pandemic. We've noted the challenges in, we have essential medical technology that's helpful for pandemic response. Connecting the right organization in the right geographic setting can be challenging. It's definitely improved a lot. The Psrt organizations like the WHO have also really stepped up, in addition to USAID, to be able to have those opportunities to engage. So I think there are a lot of positive routes to do that, but obviously, there are, depending on the industry, and I'm generalizing, still issues with trust and in terms of how the industry are viewed and what their motives are. And so I think these platforms that are shared and collective platforms that allow industry in a consolidated voice are very important for bridging those gaps.
Thank you. And the next question is for Ralph in the chat. I also hear about telecom companies being engaged during emergencies to help spread information through their platforms. But are there other ways that companies like Orange would like to be engaged? Do we, at the development sector, think about your involvement too narrowly? And are there broader things that we should be considering?
Okay. Obviously, during the emergency or epidemiologic, Orange contribute and commit for the sometime more often from the request from the government, the ministry, to use I will say MNO platform to push notification, spread notification from the platform to all the people as much possible. So we already done, and we continue to do it depend of the project or the request of the government. So that kind of the platform we use today, like pushing vocal, SMS, web also to notify the people in emergency case. And that's kind of technology we can do it as much as necessary. So depend things. And also I forgot to mention that the thing is that can bring the private sector and mainly the operator, not maybe Orange, but also Orange, but is the hosting platform, because I see many projects hosting that health data without confidentiality, without security. And sometimes, we can see some other things doing in the project in the field, and even, the platform is in cloud in outside the country. So that kind of stuff, so that the private sector and intervene in local is very important to have hosting, confidentiality, security in secure way for the health data. But also I want to mention is very important. So to come back to the spread of the SMS, that's something that we already done, and we're going to do it again.
Great, thank you. So another question from the chat. What are some thoughts that the panelists have about ensuring the longevity of private sector engagements? Or I guess what is the appropriate term for such engagements? How long and how lasting should they be? Are there market shaping approaches that we can build in to create sort of these lasting linkages between the public and private sector? And what is sort of the arc of the partnership? Grant, do you want to start us off on that one? And then we'll go to Ralph, and then maybe...
Yeah, this is a really good question. And it, at least in the work that we're doing, informs the backbone of our approach. We want to ensure that any activity is sustainable. And the way that we approach that is developing what we believe to be high value and high need in terms of the public sector's health efforts. It's not always easy, and I think one of the things that collectively we're all striving to do is, even donors are striving towards having sustainable programs that outlast the initial donor response. So in terms of industry's contributions, developing tools and technologies and services that are of high value, that are fit for purpose for the setting, and going to be making a public health impact are certainly key characteristics that help along that arc towards sustainability.
Great, thanks. Ralph, do you have thoughts on that question?
Yeah, sure. So on my experience in different projects we have already with funding provider and the ministry, the contract we sign is depending is public-private partnership on the period between 3 and 5 years. Makes that we're going to quote everything on the spreadsheet, financial sheet, and we're going to study the sustainability. The sustainability is very important. How after the first, I would say, supporting financial support with funding provider, what's going to happen after the 3 years or 2 years contract. So that's we study on the field with the ministry and the partner stakeholder how the private sector to handle the sustainability with the Ministry of Health, how we can, bring, together and maybe have, sometime we can, the private sector need to contribute to I would say, decrease the price, discount, in kind, to make sure that the Ministry of Health can afford the next sustainability after the 3 years or 5 years contract. So that's kind of financial and I would say business plan and business model has to be studied with the stakeholder. So yeah, you have to study to make the markup, the price, how can the patient can afford or not. So that's many indicator that the project has to be sustainable.
Thank you. And Philippe, from the USAID perspective, do you have thoughts on how to build long-term relationships between the public and private sector sort of outside of the project cycle?
Thank you, Kelly, for the question. So, the question about the importance of private sector in health system, that's really a very, very key question. So I think that we know that it's very important when we go for communication. We use all these communication tools that are developed by private sector or just the expertise for private sector. So we need the private sector for medical insurance. So we need, private sector in every single aspect of the health system that we are running currently. I think that the best approach for the sustainability, you have to think about how we can, or private sector and the public sector, they can develop a sustainability framework, and also to see within this framework if there will be a kind of capability transfer or just a building capacity just for the private sector to be able at certain time just to take responsibility for these the activities or the intervention supported by private sector. That's one thing. Just okay, a way to see in the long term how the private sector will be able to transfer some of the capacities. So the second is just, the private sector is funding a huge piece of the health needs. So I think that at the long time, we see then how the private sector can support, the public sector just to build a financial system which will be able just to continue running some of these activities or interventions that supported by the private sector. I think just building a sustainability framework or just a master plan on working together, expanding widely that partnership, and also just to see a transfer or a transition of some of these activities that will help the ability or the sustainability of these activities. Over to you.
Great, thank you. I want to thank all of our panelists for a very rich discussion today. I'm going to give you a chance to give us sort of your closing thoughts and remarks. But before I do, maybe I'll just recap a little bit because I think this has been a very rich discussion. We started out talking a little bit about some of the impediments to better collaboration during the preparedness stage between the public and private sector, and how sometimes there is a lack of trust or not sharing language, or just differences in interpretation between the two sides in terms of how forward-looking and future-looking they might be. But then I think we got really into some rich discussion about some great examples of where private sector voices can band together to really provide that additional voice during preparedness or during quote-unquote normal times. We talked about the potential for technology to really help and support in different ways, and the ways that we can really build relationships for the long term. So if we get a little bit forward thinking, I want, as each panelist sort of concludes with their remarks, do you have any key things that you want to build on to move forward, on key examples of the successes, or one sort of wish for what you'd like to see happen to improve both public and private sector collaboration for health systems resilience going forward? James, I'm gonna let you take the first stab at closing remarks, and then we'll run through the panelists.
Sure, thank you very much. I'll keep it brief, but I think in writing this paper, in discussing the strategic approach, we had to, and this is my message to everyone, we had to embrace the chaos. We have to understand that there will never be a very clear strategy, step by step, that will resonate for every emergency in every country. However, the sort of pillars of health system resilience are the same. And so embracing that complexity, understanding that this will involve difficult discussions, difficult decisions with numerous partners, that's just part of what we're talking about here. So we need, as partners, to embrace that. Thank you.
Great. Ralph, closing thoughts?
Yeah, I didn't. Could you ask again the question? Sorry.
It's just your closing thoughts, or what would you like to leave us with? What's your wish for the future of collaboration? For the future, maybe I will see. I will give you an example. Today, the tendency is to work with many stakeholders. Many, I will say, not just one private sector. We focus on global health. I mean, how you can answer globally to strengthen the health system for the ministry. Not only focus on connectivity or tools separately. How are you going to see globally to strengthen the system? So today we start some of the I will say committee with different partners, funding provider, different private sector to try to build and to understand country by country what's going to be all the system. For example, today I think
the next step will be for how to bring the interoperability of the older system. Today, if you go in the country, you can see bunch of systems. Every country has bunch, and sometime in the country you can see redundancy of the same tools in the ministry. So how to homogenize all this system with interoperability of the system to make that all these tools talk each other and collect all information. That's, for me, I will say the next tendency and the next project, global health, One Health.
Thank you. Philippe.
Thank you very much. So in a few words, I will say, I think that we have seen or realized that no one entity can address all challenges we are faced about emerging diseases or any health system. So the success we rely on building meaningful and wide-ranging partnership with private sector at different levels of the health system. So one of the things, the mission of the Global Health Security Agenda, and for sure for USAID, is just to mobilize industries, private sector, just to help the countries prevent, detect, and respond to any health-related crisis, and also building the system, building the systems for health security. So that is one of the big missions. So with this, there's very, very clear examples were shown in the COVID response. So we have seen so many private sector investing in this COVID response. Just as my colleague said, so we use the technology for real-time information about surveillance, tracking contact, and then also in reporting and collecting and gathering all this information. That was the key contribution of the private sector. And beyond that, so we have a couple, for example, where industries or just some business have really financed the COVID response. So leaving the private sector, we won't be achieving much. That's what I can say in a few words. Over.
Thank you. And Grant, you get the last word.
Okay, great. Thank you. I'll be very quick because I know we're reaching time. I really agree with what James said. Embrace the chaos, and I would add, be ready. And, what we observed during the COVID pandemic is there was chaos, we were not ready. And I think it was a very big lesson that we've all learned collectively across the entire world, that when something like this happens, it affects everybody. And we're all in it together to work, and it's organizations like USAID, the SHOPS Plus, the Psrt, all of these organizations that have for years been undertaking efforts to mobilize and get different groups together. My personal hope is that this is further strengthened and bolstered so that we can better deal with the current pandemic and prepare for future pandemics. Thank you.
Thank you. I like that. Embrace the chaos and be ready. So I really want to thank all of the panelists and apps for both organizing this webinar and also the great report that inspired it. I don't know if there's any closing logistics that Elizabeth has.
I'll just, on behalf of SHOPS Plus, thank all our panelists. Thank you to all the attendees. You can reach us at shopsplusproject.org, and just thank you for such a rich discussion. Stay safe, everyone. Appreciate it.